Now that the Finance Committee's done, the health care debate will soon be on the Senate floor. The bill passed this week by the Finance Committee, and then of course there's a bill out of the Senate Health Committee back in June. They will be merged by Democratic leaders into yet another bill for all 100 senators to consider. I voted against the Finance Committee bill this week, not because I support the status quo, but because the bill didn't do enough to drive down the high costs that are straining family budgets and making it harder for employers to offer coverage, especially for small business employers. Most people's insurance premiums would go up under the plan. Altogether, the bill would mean the biggest expansion of Medicaid since the program was created in 1965, about 11 million more people. And it would increase the size of government by $1.8 trillion when fully implemented. Instead of creating an elaborate new tax and spend health care plan, Congress should pass with broad bipartisan support delivery system reforms that increase quality and decrease costs, and we know that can be done. Congress should pass medical malpractice reform to reduce abusive lawsuits that drive up costs and at the same time limit access to doctors. It only makes sense to create an environment where doctors don't have to engage in defensive medicine just to keep their practices open because somebody might sue them. Congress also needs to pass new requirements on insurance companies to make coverage more affordable and accessible, especially for small businesses and for people who aren't covered by their employers. I'll continue to stay engaged in this debate, seeking fair treatment for rural health care and making sure that Congress lives under the same new health care system that it passed for the rest of the country.